Around the world, 53,000 people suffer from involuntary movement caused by PKD.
Hello, I'm Sebastian Laurent, founder of the Foundation of Rare Diseases Awareness Naturally Kinesogenic, or FRANK. Many people around the world are unaware of the disease paroxysmal kinesogenic dyskinesia, or PKD. The reality is, around the world, tens of thousands of people are afflicted with this disease. Let's talk to a resident scientist, Dr. Frank Daly, to learn more about what this disease is.
Thanks. PKD is a genetic disorder that causes involuntary motion, which is caused by stunt movement. This can be anything from riding too fast or standing up too fast. Now, here's some more. Let's hear from a guy I know pretty well. PKD is caused by a mutation in the PRRT2 gene. It can be inherited in many ways, but the most common way is from a frameshift deletion mutation. To learn more about it, let's listen to Winston Scoggins.
This deletion of a single base in DNA causes the whole sequence afterwards to be one off. Transcription, the process of copying DNA into RNA using base pairing rules of A to T and C to G, will then have the wrong set of bases. These complementary bases are then translated into amino acids based on groups of 3 called codons. Because the deletion mutation shifted every base back 1, this completely screws up the amino acids being made into a protein. In this case, it causes a stop codon to be formed early, stopping the amino acid chain prematurely. This ends up creating the wrong protein instead of the correct PRRT2 protein. If you don't have the PRR2 protein, the nervous system cannot send the right signals to your muscles, aka there's a messaging error. This includes involuntary movement.
Even the simplest things can cause an attack of PKD. Let's get a real-world example of someone affected by the disease.
Hello, I'm Nicholas Laurent, and I have been diagnosed with PKD. Every time I stand up too fast or perform any sudden motion, I feel an attack coming on. These attacks involve my left arm swinging wildly all over the place, and I can't control it whatsoever. Recently, I went to a neurologist, and they prescribed me this drug called oxcarbazepine. Although it does negate the effects, it's not exactly a cure for my disease. As a person living with that disease, I would say that it was just really hard to just live a normal life. I was scared of standing up because I knew that I would lose control of my arm and it would be this whole weird thing. But once I got the medicine, things were much better. I stopped being scared, and it was a huge relief and knowing that I could go back to a relatively normal life again.
As that man just said, there is no cure for PKD. Let's see how we can treat it. Hello, my name is Sebastian Laurent, and I'm here to teach you about diagnosis and treatments for PKD. There is extremely specific guidelines to diagnose PKD. They are, you have to have an identified kinesogenic trigger for the attacks, a short duration of attacks under a minute, no loss of consciousness or no pain during attacks, exclusion of other organic diseases and normal neurologic examination results, control of attacks with an anti-epileptic drug such as carbamazepine or phenytoin if tried, and age at onset between 1 and 20 years if there's no family history. Age criteria isn't as important in the familial cases. Cases with older age of onset have been described in instances where there's a family history of PKD. That was directly quoted from the NIH.gov website.
As Nicholas said, we often prescribe carbamazepine to deal with PKD. Carbamazepine works by reducing the amount of glutamate, which is a chemical in the brain that can cause seizures if there's too much of it, stopping the wrong electrical signals from reaching your muscles, stopping your movement. Thankfully, someone living with this disease has a normal life expectancy. Unlike lots of other genetic disorders, PKD is not considered a fatal disease.
Some fun facts about PKD. PKD usually affects the limbs, but can affect the whole body. Attacks last less than a minute on average. PKD is most common in people of Asian heritage. PKD happens more in males than females at a 3.75 to 1 ratio, although PKD is not a sex-linked trait. PKD is autosomal dominant, and the vast majority of cases happen under 20 years old.
Funded by the Frank Foundation. Thanks for watching.